Good afternoon, everyone. It is a pleasure to talk about practical aspects of burns nutrition management in today's session. And I would like to thank RD Board and Indian Dietetic Association for giving me this wonderful opportunity today. Before we begin for the session, I would just like to introduce you all with my burn unit and institution. So burn unit at Choitharam Hospital and Research Center is a 16-bedded unit where we treat all age group patients from pediatric to the geriatric age, all kind of patients. And we do have a very good multidisciplinary team who manages burns at our center. And this multidisciplinary team includes occupational therapist, physiotherapist, counselor, trained nursing staff, and me as a dietitian, our surgeons, anesthetists, and the pain management specialist. So it is an art of state unit where I belongs to. Also, our unit is an international training center for burns, and we do have fellows coming all around the world to get trained for the burn surgeries as well as for the burns nutrition. Now, before we begin to the burns nutrition management, I would just like to highlight you about the pathophysiology of the burn, types of burns and degree of burns for the basic understanding. And then we'll learn about the nutrition therapy, metabolic responses, recommendation and guidelines, the care process model, and also the practical cases from my own unit. So what do you think? Burn is a disease? No, actually, by WHO, burn is an acute injury to the skin and other organic tissue, primarily caused by heat or due to radiation, radioactivity, electricity, friction, or contact with the chemicals. So if you can see in this picture, the normal texture of the skin has all different layers, epidermis, dermis, and subcutaneous tissues, muscles. But when it comes to the burns, the different part of the skin get involved in the different degree of burn, and the cells and tissues get damaged. Now let's have a look about the type of burns. So there are different type of burns depending upon the causative agent: flame burn, scalp burn, chemical burn, electric burn, and molten metal burn. So for the flame burns, the causative agents are liquid petroleum gas, LPG gas, fuels like petrol, diesel, kerosene. And the scalp burn is relevant to the hot liquids and beverages like hot milk, hot water, tea, coffee, hot soups, etc., etc. The chemical burns are mainly related to the chemical agents like acids and industrial chemical agents which can harm to the skin and damage to the cells and tissues. The electric burns are related to the high voltage power current. Molten metal burns are relevant to the industrial and commercial areas where they use liquid metals, which is really hot and high in temperature and can easily damage to the skin. Now we'll have a look about the degree of the depth of the burns. So the degree of burn is dependent on the involvement of the part of skin. So if you can see in the first degree burn, the superficial part of the skin called epidermis is involved, and it is more painful. It looks dry, redness, and mild edema over the burn area. If you can see in this picture here, the second degree burn involves the second layer of the skin known as dermis. Also, this is painful. It has redness over the burn area and it has some moisture and blisters over the burnt area. The third degree burn is known as the severe burns, where it involves subcutaneous layer of the skin and it has relatively less pain. It looks white and leathery in the texture. The fourth degree burn are the most serious burns, where it involves tendons and